Thank you, Professor. Honorable attendants, allow me to present the work of our department entitled Onychoscopy in Nail Psoriasis, insights from a study of 75 patients. Our presentation will unfold as follows, starting with an introduction, patients and methods, results, and discussion before concluding. Psoriasis is a common chronic inflammatory disease. It is associated with more than 40% of cutaneous psoriasis cases and over than 80% of psoriatic arthritis cases. It can also be isolated in 5% of cases. The objective of our study is to investigate the association between dermoscopic features and the severity of psoriasis and the presence of psoriatic arthritis in patients followed in our department. This is a retrospective, descriptive, and analytical study conducted over a period of 2 years from December 2021 to December 2023 within our department. 75 patients followed for nail psoriasis were included after excluding onychomycosis. Patients with systemic disease or other dermatosis affecting the nails were also excluded. A clinical and dermoscopic examination of all nails was conducted. Skin severity was assessed using PASI score. Patients were classified into two groups, severe and non-severe PASI. Their involvement was assessed using the NAPSI score. Patients were classified into two groups, severe and non-severe NAPSI. Also, patients were classified based on the presence or not of psoriatic arthritis. The analytical study was performed. A threshold of P less than 0.05 was considered statistically significant. Among the 75 patients, 67% had plaque psoriasis, 13% had guttate psoriasis, 12% had erythrodermic psoriasis, and 8% had pustular psoriasis. Nail involvement was initial in 23% of cases and concurrence with skin involvement in 41% cases. It affected the hands in 30% of cases and feet in 40% of cases. The mean PASI was 17.1 and the mean NAPSI was 29.5. 29% had psoriatic arthritis. The most frequently observed dermoscopic features included distal onycholysis in 66%, xanthonychia in 64%, transverse grooves in 58%, subungual hyperkeratosis in 57%, trachyonychia, nail pitons, pachyonychia in 52%, splinter hemorrhages, and Salmon patches. Various dermoscopic aspects of nail psoriasis have been reported in the literature. The most frequently found dermoscopic features in a study of 30 patients from Casablanca by Mejouar and collaborators were subungual hyperkeratosis in 56%, filiform hemorrhages in 46%, Salmon patches in 40%. According to an Indian study, onycholysis, splinter hemorrhages, pitting nails, longitudinal features, and oil dropping design were identified as the most common dermoscopic features in psoriasis. Our study identified aspects of xanthonychia and pachyonychia that were not described in the previous series. There are some dermoscopic features which we found in our study. On the left, we have splinter hemorrhages. On the right, we have an image of onycholysis and Salmon patches. On the left, we have a longitudinal rise. On the right, we have an image of both lines. On the left here, we have an image of onycholysis associated with Fuzzy lunula. On the right, we have a clinical image of trachyonychia. A statistically significant association was noted between trachyonychia, pachyonychia, and the severity of skin involvement. There are a few studies that have examined the association of dermoscopic features with skin severity. According to a Chinese series where 135 patients were collected, PASI scores were higher in patients presenting trachyonychia. Although it was not statistically significant. The association with pachyonychia has not been reported in the literature. In our study, a severe NAPSI was predominant among patients with onycholysis, trachyonychia, subungual hyperkeratosis, and pachyonychia, with no statistically significance. In the Casablanca study, splinter hemorrhages, the pitting nails, and distal onycholysis were positively associated with the severity of nail psoriasis. Yalomraz and collaborators concluded significant association between certain onychoscopic features, including subungual hyperkeratosis, Bowes line, trachyonychia, Salmon patches, and NAPSI severity. In our study, a statistically significant association was noted between splinter hemorrhages, Salmon patches, leukonychia, and psoriatic arthritis. Floran and collaborators reported an association of onycholysis pitting nails, subungual hyperkeratosis, and psoriatic arthritis. Our results shows features that have been widely reported in the context of psoriatic arthritis. Thus, they demonstrate a significant association with psoriatic arthritis. In conclusion, the dermoscope is a non-invasive tool that facilitates the early diagnosis of nail psoriasis. Few studies have demonstrated a significant association between nail involvement and the severity of psoriasis, as well as the presence of psoriatic arthritis. Our study showed the association of trachonicia and pachyonychia with skin severity. It also demonstrated the association, the splinter hemorrhages, leukonychia, Salmon patches with psoriatic arthritis for the first time to our knowledge. And thank you for your attention.